Namaskar. Okay, I have Yang with me again, and this time what we're doing is we're adding a little bit on to a blog post that was done at Oral Wellness Center. And you probably have noticed by now that there are two different blogs, and both of them have different sorts of information. This one relates to the three postures that we discussed in that article about hip dysplasia. And I want to stress that you really have to go by what your doctor recommends or specialist recommends, because not everybody is in the same boat. Sometimes you have to have surgery. Unfortunately, that is the case. On the other hand, there's sometimes where pain relief might come from a non-surgical method like yoga. So what we're going to do is we're going to go into the very first one, which is extended child pose. I'm going to get out of the way and let Yang take the mat over. And I'm just going to scoot back. And he's going to go into, some of you call it mecha pose as well. And he went into the wide angle variation right away. And I'm going to show you the benefits of the wide angle variation. His knees are wide, okay? His toes are, his big toes are touching. And go ahead and extend out into this one. Okay. Not everyone's spine is in the same boat either. The thing here is you're looking at getting the straightest possible line. You're going to get more of a straight line with your knees out wide than you will with the knees folded in, because usually what happens is there's a little bit of rounding. Also, let's put it this way. If somebody is really thin and they fold up and they have a straight spine, that works. But if someone is not thin and they're a little bit on the not so thin side, then what's going to happen is they're going to round off even more and they're going to have difficulty breathing. So show us the other variation of extended child. So he's going to bring his knees in. And his knees, just so we know, the knees line up right under the hips. And his feet, you want to keep your feet in line with your knees. Good. And your hands right under your shoulders as a set point. Good. And then from now, go ahead and into it again. Yeah? And you can see quite a bit of difference here. There's a little bit more rounding. Some people who I work with, they have extraordinarily straight backs. So on this particular posture, they're going to have a straight back. This is something that it's the way the spine is made, and it's also a matter of how much muscle or how much fat a person is composed of. Okay, next thing I'm going to ask you to do is come up to all fours. So he's in all fours, and we call it all fours, or sometimes we call it table pose. On this one, what he's going to do is going to make sure his hands are directly under his shoulders and his knees are straight away, and also when you look through your legs from the front, just make sure that, that you can make sure that your knees are in line with the feet. Okay, what he's going to do here is a simple cat-cow, okay? So I'm going to ask him to do cow first. So we're going to inhale up, so he inhales up. So this also very slightly works the hip, good, and then exhale, and exhale into cat, and there we have it. Everyone's going to do this a little bit different. People's bodies are not all the same. Go ahead, inhale again. And exhale. Inhale. And exhale. Now, go ahead out into table. We're doing this a little bit fast for the sake of the web clip, actually. If this were Yang and Yang had this problem, I might suggest that he take time with all of these things that we've done so far. For example, an extended child pose, there's no harm in holding that pose for a couple of minutes. Same thing here. why not let it run right through with your inhale and right through with your exhale, the full inhale and the full exhale. The last one we're going to do, and we're not going to do it as slowly as we normally would, but what we're going to do here is a leg extension, and it's also called half plank. So extend your left leg. Okay, so he's trying to get parallel to the floor, head in line. Good. Okay, now bring your knee toward your chest and exhale. See, on this one he's keeping fairly straight. So go ahead, inhale again. Yeah, and exhale, bring it in. Good, inhale again. And exhale, bring it in. And inhale. Good, and then come back to all fours. Okay, this, like I said, was a lot faster than what I even explained in the article. Okay, what I'm going to do is show you on the opposite side another variation of a way to do this. Go ahead and extend, and this time go ahead and round off on your exhale. Just relax. Good. So that's good. You can do Ujjayi breathing again. Go ahead. Make sure it's all through the nose. Good. And exhale. Yeah. And inhale. And one more. Exhale. Very nice. Inhale. And relax. Okay. Go ahead and have a seat and relax. Okay. At this point, I just want to mention a couple of things. Obviously, you would want to take your time with these postures a little more. You could stretch this routine out into a half hour if you like. It's not taxing, it's very easy to do, and I can't promise you that it will do anything more than relieve pain. That's probably the most any of us can offer. And beyond that, sometimes with no pain comes healing. So you can take this practice and see what you can do with it. It's one of those things where if you work with postures long enough and see if they fit into your routine, you're going to be fine. And you know, if something causes pain, especially in the joint, the hip joint or the knees, you don't want to continue the practice. With that said, I want to wish all of you a nice week. Om Shanti.